when we usually give a medical talk, we ask to say a declaration or conflict of interest, whether this talk is being sponsored or you're affected by the pharmaceutical companies. So my first declaration, what patient wants has nothing to do with the movie of what women want. Because neither I or Mel Gibson can figure out what women want. But we can talk today about what patient might want. Okay, so first question is live from my kitchen. And I have 5 kids. And this is, the one in the middle is number 3. He was at this picture was 12. And the far left one is number 4, who at that time was 10. And the little one, who at this time was probably between 1.5 to 2. Once upon a time, I came out of my usual busy day, coming out of my clinic in the afternoon. So it was around 6 o'clock or 7. That day was long enough that I really was looking forward to go and sit with my kids, at least play the father thing that we all try to do. And I went into this kitchen trying to draw their attention. 1 minute, 2 minutes, 5 minutes, 10 minutes, no sign of any reaction with me. All what they do is they were hooked to their gadgets. Now, 2 messages you can get out of this. 1, this is the millennials, and I'm not going to ask who is not millennial in this room, because I'm not. Okay? So, the first message you would say that this is the new generation who are tech savvy, yet they lost their social etiquette. They don't socialize, but you can very much communicate with them by sending them messages, and that's what I do with my teenagers. If it's something nice, I would say to them in front of them, but if I really want to send them a bad message, I will send it through a social media, and they will answer back. So, a month after that, I realized that my little boy was diagnosed with autism. And as a parent, it was a shock. And there were different ways of saying this, and this is not the scope of talking about autism here, or special needs. But as in leadership, they say, whenever you find a challenge, there's always an opportunity. So a week after, we were talking on our innovation board, and there was this lady who was talking to me about an app that would help her to monitor her autistic girl at the school, and because she would like to know everything about it. And she was wondering if she could lobby with people who would do that. And I raised my hand. I said, you have one parent here. And then we sat and we talked, and we started refining this. And very soon, this was all the way to the executive office and was seen by the Crown Prince, who liked it. The point is, technology is going to change everything. I sat at a strategy lead called Care Model Innovation, and I sat every day and I say, okay, this is the way we deliver medicine. How are we going to deliver it differently? So it's not about doing different things, it's about doing it differently. And I can tell you, this is not going to be a far future. This is going to be very soon. It's not going to be the traditional paradigm where you go and see the doctors at their convenience in the waiting area and wait for them to be seen. It's going to be medical health or health service where you are, convenient to you, personalized to you. And we're going to use a lot of things like artificial intelligence. We're going to put all these gadgets. How many of you are wearing Fitbits? Okay, so we're going to gather a lot of information from these things, and we're going to know a lot about you. But not only this, we're going to also hook this to what you shop, what you buy, what you eat, and we're going to have a big profile to you. Facebook is now having a big investment in the healthcare. So again, this is not the scope of this talk, but what I want to say is the way we deliver healthcare is going to be so different And Dubai and UAE is going to be one of the first areas where we start using all these things of AI, blockchains, and all these things. That is probably a scope of another talk. But really, when you sit and talk to patients, this question hits me when I first came, and I was so happy with all the qualifications that Neda was struggling pronouncing it. And I thought I will come to UAE, I'll just put my ads, and I'll have so many patients waiting in front, just lining up to come and see me. That ain't gonna happen, as they say. This didn't happen. And it took me 4 years to realize one GP with a little diploma somewhere in, I'm not gonna say where, has much more patient than me. And it was always a question to me, what would make patient go to that doctor and don't come to me? And when we searched this, and that's what I did my MBA and I'm finishing the book, is what really patient want, and it all comes to this. So patient would not like to have a bad receptionist to talk to them, nor a bad, lousy call center to answer them or to give them press 9, press 10, and then if you want to talk, and just dial the 0. All right? So they don't like it. And when the Crown Prince came to Rashid Hospital a month ago, all what he cared about is don't have the patient to wait. So waiting is a big issue. Now, if they don't get the parking, this is also things that would make them cranky, lousy, and everything. So all these things affects, but really, really what really comes to this is the physician manner or the medical staff manners. All the studies have shown that a patient can turn a blind eye to your lousy medical mistakes if they liked you. And they will just wait for something to see you if they think you are a word that I'm going to not say in public. So here comes my rule of the first 2 minutes. And in the first 2 minutes, have the patient come in, please shut up, don't talk, let the patient say what they want to say. Because I'm going to tell you something. You don't have to be an expert in body languages, but you will know exactly what they want. And I group these patients into 5 different categories, but there will be one who is really coming to seek your help, someone who already knows what he has, and he just wants to have a second opinion. Someone else, he just comes for an investigation to confirm something. And there is somebody who really doesn't have a clue that you have to lead them. All you will know, only in the first 2 minutes, all you have to do is to sit and listen to them and to stare at them. By the way, I tried this with a young girl. She almost went and complained to me among the reception that I was staring too much. So try to balance this. All right? So they will always ask, yeah, I explained to him about my asthma, but he did not hear about my constipation problem. Or my son, who I was struggling for him to come and do something else. These little details makes a big difference. It will just make them, connect with you, and you know that you're special to them. So I'll end up with this. A lot of movies here today. But this is not a movie. So I used to look after a patient. I will call him Abdullah, but his name is something else. Because I'm going to get into trouble for sure. So I picked him up as a child, and he had a heart transplant. And as a natural history of any transplant, they run into something called rejection and transplant complications. So I picked him up at probably around in his teens, when he started to have a lung complications. And at that time, he was so pampered by his family, given, and these kind of patients that you can't just deal with them, that I will see you next 3 months of it. So I gave him my number. I gave him my WhatsApp, which became a clinic. By the way, my WhatsApp is an actual clinic. People sending me CT scans and skin lesions, and at 24/7. Okay, so we need probably to have a talk about how do we utilize the socialized media in the medical way, where it doesn't really affect your social life because at the end of the day, you are a physician, but you're a human being. Anyways, so we looked after him, and as he grew older, I became old, and I was still looking after him. He died. And I was there doing the CPR for him, and I could see his soul leaving us. That's not the end of the story. 3 days later, I got a call from a number in UK. A British lady on the other line saying to me, "Are you Dr. Mahboub?" I said, "Yes." And she said, "Did you used to look after Abdullah?" I said, "Yes, but I don't remember seeing you with him or with his family." She said, "Well, Doc, I want to tell you something. That heart that Abdullah had was my son's heart. Thanks for looking after my heart. I guess that's what patient wants. Thank you."